Hello, I'm going to talk to you about fever in children today, children being anybody less than 16 years of age. So, fever is defined as a temperature of 37.5 degrees or higher. Your child has probably been seen in A&E and seemed fit to be discharged from excellent emergency department. But if at any point you've got concerns, please call 111 or go and see your GP. So how do you know if your child has a temperature? So if your child feels hot, then you can check your child's temperature by using a thermometer, either a thermometer that is under the arms for all ages, or the one that goes into the ear for children above 1 month of age, or putting a thermometer under their tongue. The thermometers that are the forehead strip ones are not reliable, so please do not use them. So why do children have temperature? Children have temperature because they have an infection. And basically fever is body's mechanism, body's way of fighting the infection, because the bacteria and viruses do not grow very well at higher body temperatures. Basically viral infections are much more common than bacterial infections. Bacterial infections need treatment with antibiotics, but viral infections get better on their own. They do not need any treatment. So how do you make your child comfortable? So if your child just has fever and is otherwise okay, then you do not need to treat the fever. And what you can do is you can expose the child's body. So you take away all the clothes and try not to wrap them up in blankets. Keep the room well ventilated, so you may want to open the windows and allow fresh air to come in. Do not do sponging. Cold sponging is not recommended anymore. Do not put water on your child. One, it's very uncomfortable, and second, it's not recommended because it can cause harm. Give the child plenty of fluids. If the child is breastfed, then feed them more frequently. If the child is not happy and if they are uncomfortable, then you may want to give them some paracetamol. Ibuprofen is also very good and works faster. So you try paracetamol first. If that does not work within an hour, then give a dose of ibuprofen. Use the doses that are recommended on the bottle because there are different strengths. But do not hesitate to use paracetamol if your child is very uncomfortable or the fever is going very high. If you are worried that your child is not well, then call 111 or see your GP immediately. The signs that you need to look for are if the child is complaining of a stiff neck, or if they are complaining of pain in the eyes when they are looking at direct light, if they are vomiting or refusing to drink much, if there is any rash on the body, especially if the rash is not blanching, if they are more sleepy than usual, or if they are having difficulty in breathing or are in pain, or if they are complaining of headache or pain in any particular joint, or if they start fitting, that is, if they are having a convulsion, then you need to seek medical attention as soon as possible. So if you're worried, then you should bring your child to A&E or call 111 or go to your GP if possible.